So, good afternoon, ma'am. I am Soriano. I'm going to discuss the laboratory test result. So, for a laboratory test result is a procedure in which a healthcare provider takes a sample of your blood, urine, other bodily fluid, or body tissue to get information about your health. Some lab tests are used to help diagnose, screen, or monitor a specific disease or condition. So, naatay mga significant nga laboratory findings as follows. So, mao ni siya: platelet, creatinine, um, SGOT, LGD, LDH, and also the urine dipstick, proteinuria. So, for the platelet, ang normal range sa platelet, is 150,000 to 450,000 mm3. And then for the result sa patient is 90,000 mm3. So, low ang iyang platelet then sa patient. And then for the interpretation sa is if ang platelet count drops below normal levels during pregnancy, it most likely that you have a common pregnancy condition called gestational thrombocytopenia. Then for the creatinine or zero, ang normal range is 0.5 to 1.0 millimeter milligrams per deciliter, and the result for the patient is 1.7 milligrams per deciliter. So, that's ang creatinine. And then the interpretation is a blockage is in the flow of urine such as an enlarged prostate or kidney stone could cause kidney obstruction. This blockage can create a backup of urine into the kidney and impair the kidney's ability to function correctly, which might raise the level of creatinine. Ang napudtay SGOT. Ang normal range is 9 to 32 international units per liter. So, ang result sa patient is 650 international units per liter. 650. So, taas ang iyang LDH. Then, ang international, preeclampsia. Ang interpretation is preeclampsia and eclampsia complicate 6 to 8% of all pregnancies and lead to various maternal and fetal complications. These are multi-system disorders and lead to a lot of cellular death. LDH is an intracellular enzyme and its level is increased in this woman due to cellular death. And lastly, the urine dipstick proteinuria. Ang normal range is 0 to 14 milligrams per deciliter for a 24-hour urine collection. The normal value is less than 80 milligrams per 24 hours. Then the result for the patient is positive 3. So the interpretation is people with proteinuria have unusually high amounts of protein in their urine. The condition is often a sign of kidney disease. So, a sign of disease. So for the fetal well-being was also check the cardiotocography or CTG. It is used during pregnancy to monitor fetal heart rate and uterine contractions. It is most commonly used in the third trimester, and its purpose is to monitor fetal well-being and allow early detection of fetal distress. and abnormal CTG may indicate the need for further investigation and potential interventions. The ang CTG is ano ba siya, technical means of recording the fetal heartbeat and the uterine contraction being pregnancy. So that so this is the reference. So that's all. Thank you.